Good morning. My name is Erin Congleton, and today I'll be discussing Kristen Swanson's theory of caring and healing. Dr. Swanson graduated from the University of Rhode Island, magna cum laude with her BSN degree. She then went and got her master's degree at the University of Pennsylvania in Philadelphia, and then obtained her PhD from the nursing program at the University of Colorado in Denver. Early in Dr. Swanson's career, she sought out to work with and have Dr. Jean Watson be her mentor in her doctoral program and dissertation project. Dr. Jean Watson has been credited with the theory of human caring. Dr. Swanson and Dr. Watson never worked together on research projects that combine both research theories and actions, but both theorists agree that their individual assertions and outcomes assist to validate findings from both theories. Authors Butts and Rich describe a statement discussed by Swanson regarding this theory as being based on a nurturing way of relating to a valued other toward whom one feels a personal sense of commitment and responsibility. This was discussed in their book Philosophies and Theories for Advanced Nursing Practice, 3rd edition, page 551. Dr. Swanson's theory was developed from insights gleaned early in her career, working with couples experiencing loss from miscarriages. She felt that caring interventions, something that nurses find intuitive, was able to deduce results in terms of decreased depression, improved mood, decreased anger, and intervention satisfaction, according to Butts and Rich, 2018. This theory could be applied in any type of hospital setting or medical setting for that matter. This diagram shows all 5 processes that lead to the well-being of patients that nurses care for. All of these processes can be performed in order to provide the best nurturing care for patients and enable self-actualization of health goals or preferred outcomes. In Swanson's theory, nursing entails nurses learning about what patients' needs are anytime while in our care or during their duration of sickness. This may include all that are important to that patient, which include spiritual needs, emotional needs, social needs, which can include that patient specifically, or that patient's family, or friends, or any combination that is important to that patient. The process of being with includes the feeling the nurse needs to elicit to show that they are present and invested in the caring process of patients. This can be done in silence, with acknowledgments, and if appropriate, touch or sensory acknowledgments. Also important is keeping the patients and family members informed on processes and procedures, and if you have to leave the bedside, if they're upset, letting them know when you'll return. Doing for includes providing patient care and education, and is for learning what outcomes patients need and providing alternative options for decisions. Can also be to make sure that comfort items are made available, such as tissues, food, water. It can be to offer to sit at bedside to give family members a break. Nurses can also offer their services to assist in arranging services that may be needed, such as managing guests and arranging for spiritual providers. The process of enabling involves nurses sharing their professional knowledge and finding materials that will assist in emotional, psychosocial, and physical healing opportunities, or medical literature to help in their care plans. We can assist with items that need to be cared for and processes that need to be completed, as this is an emotional time for these patients. We need to remember to allow for breaks when needed, as this may be an overwhelming time for patients and their families. Maintaining belief is where nurses let patients and families know that there are people that can and are willing and eager to assist in this situation. Also, letting them know that different people require different amounts of time, different amounts of information, and everybody reacts differently. In this aspect, nurses are more knowledgeable about what is needed at given times because of situations that nurses have come in contact with in their professional settings. Client well-being is where the first four processes combine to make this overall well-reaching client well-being. All of these measures are to ensure the appropriate caring interventions to provide the best outcomes for patients that nurses care for. This is to build the structure of caring as linked to nurses' philosophical attitude, informed understandings, message conveyed, therapeutic actions, and intended outcome, according to Lillicuddy and Sampson, page 174 in 2018. Dr. Swanson's theory could easily be translated through the nursing metaparadigm, which includes person, which in this case would be understanding feelings and needs of patients and their families, being present, dignity, self-actualization to healing. The next avenue would be environment, which would include patients and nursing personnel who converge in the current environment in hospital settings, clinics, and community settings to obtain better patient outcomes and return to pre-situational levels of health, which can be viewed differently by different people with differing beliefs and viewpoints. Next would be health, which would include in this situation knowledge, understanding, promotion to return of health and well-being, acknowledging patient preferences, and providing education. In the nursing avenue, this would include all five processes of caring, which go hand in hand with nursing and nursing sciences. Dr. Swanson's theory originated from work studied in settings where patients had experienced miscarriages, most notably in a therapy discussion session with a couple who had recently experienced a loss from a miscarriage. At present, due to the well-designed and well-thought-out processes used in this theory, it has been used in pediatric cancer settings, perinatal settings, nursing education, mother-baby, and many more settings. A study performed at the Children's Hospital in Michigan in association with a study performed at St. Jude Children's Research Hospital was done regarding verbal and nonverbal behaviors and distress of children who were having their vascular ports placed and repeatedly accessed for chemotherapy protocols. According to this study, results showed that both parental and child distress was reduced with this theory. In the oncology practice setting, Swanson's theory of caring and healing would be beneficial to assist nurses with patients in their treatment protocols, which can include changes in level of care. This theory would also be helpful for patients and families to assist with dealing with changes in health situations of their loved ones. All five processes, as well as time, is needed to deal with health changes of those we love. In conclusion, Swanson's theory of caring and healing is a well-researched, well-documented theory which can and should be used in any healthcare setting. Processes include maintaining belief, knowing, being with, doing, and enabling, which are all needed in progression to assure the best patient outcomes. According to authors Butts and Rich, Swanson recently added to her theory, stating that when a provider takes the time to know, be with, do, and enable, and maintain belief in the other, the recipient feels a sense of wholeness. Here, I've included references for your review.